You're listening to Fast Facts, Ask the Expert with Katrina Sanders.
Hello, friends, and welcome back to Ask the Expert. My name is Katrina Sanders, and I will be your expert this month as we dive into an extremely controversial topic that continues to resurrect itself, particularly in periodontics and dental hygiene today, and that is subgingival irrigation. When do you do it, and what do you use? If you're anything like me, you went to dental hygiene school at a time when we were told to perform non-surgical treatment on our patients and then load that subgingival irrigation syringe with a medicament, probably chlorhexidine, and irrigate that subgingival space. And we were told that there was a really high substantivity, that the chlorhexidine would sit down in that subgingival space and it would remain there for a long time, providing medicinal benefits, changing that subgingival microbiota, killing the bacteria that causes gum disease, and that it was the FDA anti-gingivitis drug of choice. So this was an amazing, amazing broad spectrum medicament to use. Then we started to dive into the research looking at the fact that chlorhexidine actually can inactivate fibroblasts. And so then we started to rethink this. We started to recognize that chlorhexidine, like other medicaments, need an acquired pellicle in order to remain in the area, in order to remain in that subgingival space and have substantivity. So if we're scaling and root planing and removing that acquired pellicle, that chlorhexidine or other medicament may not have something to stick to. And so this long-standing thought we had that chlorhexidine would remain in the area and continue to kill those microbes has changed. Our goal for subgingival irrigation, we know, is to reduce that subgingival microbiota quantitatively. We want to therefore identify, do these medicaments actually render or change that subgingival microbiota? Okay. So there was a huge meta-analysis that was done. This meta-analysis was done back in 2015, and it looked at thousands of studies that compared all different kinds of SRP alone, SRP with irrigation, irrigants put into a caviton or some kind of an ultrasonic being delivered to the patient, whether it's carried out immediately following debridement, whether it's being used during maintenance visits. So it took into consideration all of these different research studies. And at the end of this meta-analysis, it came down to two optimal studies that were really definitive. And it's important that we acknowledge that two studies that really compare what we wanted to see, which is SRP alone versus SRP with irrigation of a medicament, that these two studies are just really not enough to provide statistically significant evidence. But a systematic review looked at these, and both of these studies did show that there were some improvements in the group that received irrigation versus those who received SRP alone. However, again, the expert panel kind of concluded at the end of this research study that routine subgingival irrigation with medicaments following non-surgical SRP really doesn't offer a conclusive long-term benefit for the patient. This kind of convolutes things because the ADA actually has a CDT code available for subgingival irrigation. And so there are far more beneficial alternatives to subgingival irrigation. And this is honestly where we're seeing some amazing data around the use of, for example, water flossers for patient-delivered subgingival irrigation at home. It turns out that the benefit of the patient delivering this in a more routine fashion, daily or even optimally twice a day with a water flosser into that subgingival space, actually does give statistically significant benefits. And so when we start to weigh out the benefits of doing a subgingival irrigation in office versus handing our patient a water flosser that actually does demonstrate in large systemic reviews the benefit of improving that subgingival microbiota, gingival index, bleeding indices, plaque indices, and overall response to healing, we're actually finding that putting the power in our patients' hands with routine irrigation at home versus episodic irrigation in the chair immediately following SRP actually gives us better benefits. As we continue to dive into more research, stay tuned, folks, because we know that this statement may change. But as of right now, the best way to provide subgingival irrigation is actually patient-delivered, daily, at home. And as we look at various medicaments, from water to watered-down oral antimicrobial mouth rinses and chlorhexidine, the benefits we are still continuing to explore. Well, thank you so much, my friends, for joining me, Katrina Sanders, for another fabulous episode of Ask the Expert. Stay tuned next month as we continue to dive into amazing expertise. Please feel free to reach me on Instagram at The Dental Wine Hygienist or on my website, www.katrinasanders.com. Cheers.
Thank you for listening to Fast Facts Ask the Expert. If you have a topic you'd like one of our experts to answer, simply email me, Andrew at ataleoftoahygienist.com, and we will get it on the air as soon as possible. Thanks for listening.